Okay, welcome class to this lesson. Our lesson today is regarding sexual and reproductive health. Remember, you have been doing other units, other lessons. You're almost through now, and this will be a summary. Remember, this is our last lesson regarding sexual and reproductive health. Remember, as we started our lesson, as we started this semester, we started with youth-friendly services, but we did not discuss exactly what they are, and we started with the policies. Now we are going to look at exactly what are these youth-friendly services. You are welcome, and we are going to start with what is definition. As per WHO, youth-friendly services are services that are accessible, equitable, accessible, and appropriate, and of course effective to the adolescents. Remember, as we have been noting about our adolescents, that these are a specific group that requires a lot of care, that requires a specific health care management, and therefore these services must be friendly, must be acceptable, must be equitable, must be appropriate for our adolescents. Remember, if you look at these characteristics of the youth-friendly services, they look like the primary health care, where equitability, accessibility, acceptability, appropriate, and effectiveness is very important. Therefore, youth-friendly services are services with policies and attributes that attract younger people, stroke adolescents, and meet their expectations and needs to improve their health status. So what are the approaches? There are two approaches that we can use when we are offering these youth-friendly services. One of them is targeted approach. This is where we target the specific youths, where services, for example, somewhere is excluded for only youths, and the services are designed and planned for the youth alone and offered in settings that only meet the needs for youths alone, meaning there are no other people around, there are no elderly people, there are no other cases that are seen, there is only youths. The other, number two, is integrated approach, where young people receive services as part of general approach. However, all other criteria must be met for it to be youth-friendly. Remember, youths are fearful. They fear what is stigma. They don't want to meet their parents, and they are afraid there are older people there, so they don't feel comfortable when they are together with other people. However, some of the setup in Kenya, we are only able to give the integrated services. What are the characteristics of youth-friendly services? One, we are going to start with the healthcare provider themselves. These are the doctors, the nurses, the clinical officers who are offering these services to the adolescents. One, they must be familiar with adolescent physiology and development, so that they give the need-directed services. The other one is knowledge of appropriate medical options for adolescents according to age and maturity. When you say what is adolescence, in the Kenya definition is from 13 years to 19 years. So, and you cannot handle the same, these people, a client who is not 13 years and another one who is 18 years or 19 years the same. So you have to look at what we call the age maturity. Of course, they must have undergone counseling training, working with and serving youth training, skills to communicate fluent in the youth language. And this one is very important, that there is the language that youths are currently using. So you don't need to put a very elderly person there who doesn't understand when they use Sheng or the other language they want. So we need to put someone there who is able to understand and communicate effectively with the youths. The other one is effective interpersonal skills. You don't need to put somebody there who is moody, who is looking at these people as if have what we call the prejudice. We should have somebody who is able to interact them freely so that they accept the services that will be offered. The other one is the ability to relate to youth in a respectful manner. All of us need to be respected. Remember, it is the human right, including the young, to have access to reproductive health services. It is their right to seek reproductive health service. Therefore, you must have ability to relate with them and you respect them. The other one is skills to honor youth privacy and confidentiality. Remember, youths, some of them, they don't want to be known that they are coming for the family planning or other reproductive health services, including STI management. So it is good to you as a healthcare worker to provide privacy and confidentiality on the information you are given by these people. They don't want, it is not good, it is unethical for you to get information regarding a certain person, and then maybe you meet, you know the parent of this student, this youth, and then you meet with him or her and tell them, I met with your son, he or she had come for certain services. That is ethically wrong. The other one is skills to engage in conversation about body image and development, sex, relationship, and contraceptive method options. Remember, youths, they mind about their body image. So you have to be very sensitive. You have also to be very sensitive when you're talking about sex, relationship, and contraceptive for them to accept your services. Skills to bring myths to the service to discuss and dispel them. There are so many myths that are there in regards to healthcare or to reproductive healthcare. So, and these youths have so many information that is misinformed. So it is up to you to give them clear information regarding the actual issue of their health, reproductive health. If there is maybe a youth comes to you with a question regarding a certain myth, it's good to clear it and give the fact so that they understand. The other one is characteristics of the health facility. How should the health facility look like? One, it should be convenient, be in a convenient location. Even if we are offering these services in a hospital, at least we should have the youth-friendly service located somewhere that can be easily accessible by the youths. So don't put the youth-friendly service in the middle of the hospital. It should be outside, in the periphery, and near the gate where these clients can just get in, get the services, and get out. So it is very important for the convenience of the location. The other one is adequate space where they can come, mingle with other youths, play some games, and then they get the services they require. The other one is counseling areas that provide visual and auditory privacy. Remember, as I told you, privacy is very important, especially to matters to do with sexual and reproductive health, even to adults. So it is very important for us to offer privacy when you're offering reproductive health services. The other one is examination areas that provide visual and auditory privacy. If you have to do an examination, maybe body examination, maybe you want to look at their reproductive health organs, it is very important that you observe privacy, and this will help them or make them feel comfortable, and you'll be able to make a diagnosis and maybe give the correct treatment. The other one is comfortable surroundings, that is youth-friendly. There are games there, there are friendly people there, the environment, the air conducive for them to feel comfortable when they're in the facility. What about the programs? The programs that guide our youth-friendly services we should involve our youths in designing and continuing feedback of programming. So we should not just come up with programs that we just come and start to implement without including the youth. It is very important. And this one will help in what we call sustainability and acceptability of the services. So it is very good to involve them. Maybe they give us the feedback. maybe when you're planning for the next program or services, we need to hear from them so that at least they are able to give us the feedback so that we're able to improve on our services. The other one is affordable fee. We should try to avoid fees that are hidden. And this one, basically the current health ministry, the government is doing away with most of the fees. So it is also good for us to avoid costs, either direct or indirect costs. Because as you understand, most youth, maybe they don't have money to come for these services. Therefore, when we have higher fees, this means that these young people may not come for these services. Boys and young men welcomed and served. Remember, men, it is very rare to find men. Even if you go to the hospitals right away now, you find that men are so very few. But women, you find a lot of a very long queue with women and young girls. So when a man or a boy comes, there is a policy now when a man or a man comes to the facility, we should give them priority because men are really impatient. So a man cannot wait for you 5-10 minutes. You wake up and leave. So it's very important for us to give them priority, welcome them, we serve them early, and then this one will help even be able to get a lot of men and help them in issues pertaining to youths and issues pertaining to reproductive health. The other one is the wide range of services should be available, including pregnancy, birth control, counseling, STI, HIV, and treatment. This is what we call integration with other services. So it is very important to integrate so that when this client comes to you, they will not move from that area to go and queue in another area. Maybe the client has STI. You need to treat them. If there is any investigation you have to do it. Then from there, if there is any medication, the client should get medication there. So it's good to avoid a lot of movement and a lot of referrals that may hinder the delivery of these services. Remember, youths are very sensitive, and you may send them to go and collect maybe a drug or to go and do laboratory exam, and they get away. So it is good to integrate the services we offer so that at least we get holistic care. The other one is use of number system calling instead of names in the waiting room. This is what we call anonymity. Don't start calling people by the names James, Carol, no, because this one makes them feel as if you are exposing them. So what we need is we code them by numbers. So as the client comes, we give them numbers 1, 2, 3, 4, 5, so that you say number 5, number 10. So nobody will know in fact who is that facility. So we use numbers for what we call anonymity and not the names. And then system to red flag youth with particular confidentiality concerns. This means if there is a client who has a special need, you don't need to expose that client in front of everybody. So there is a way you can tag that client so that when you give him or her priority, and then from there you're able to handle his or her case in private. Flexible hours, overlaying lunch, evening and weekend appointments. Remember, most of these young people are either in colleges, some of them are in maybe informal jobs. So we should try to enhance time where they should come and see us. Instead of crossing over lunch hour, or maybe over the weekend when they are available, or maybe after 5 p.m., we can extend the hours so that at least we are able to get them. These are the time they can come and see us, and this one will help in getting more of the youths and maybe handling them. So it is a request, we request people, even in the facilities, that we extend the hours of working for them. The other one is well-established mechanism to allow for slightly longer visits with adolescents. So it is not always good to tell them come every 2 weeks, come every. It is good if there is a client who is coming for certain medication, maybe ARVs, anti-TB drugs, we give them a longer period. So we give them a stock of maybe 3 months, considering these students are, these young people, some of them are students. So remember they are going to school for 3 months. What we do, we give them a stock of drugs that can sustain them for 3 months, and then when they are on a vacation, they can come and collect the other stock. Clinic staff is called by first name to make the environment more informal and welcoming. This is why we avoid formal names, Dr. So-and-so, Dr. So-and-so. No, we tell, we can make this youth-friendly service being more friendly when somebody is called by the name Jane, by the name Isaac, so that we look as if we are in the same level with the youth. So let's try to avoid so much formal issues that may hinder these clients coming to us. The other one is drop-in clients, welcomed and appointment alleged lapidary. There are some of the services like maybe medical surgical cases where a client cannot be admitted or cannot be seen if he had no appointment. So in our case here, you don't need to have an appointment for you to come. So any person who comes, he's seen, he's attended to, and then from there, he's given an appointment. So we don't reject patients or clients on basis that they did not have an appointment. So any client who come, we see them, and then from there, they are given an appointment. The other one is well-established linkages and referrals to mental health, education, employment, and social services. Remember, the main aim of our youth-friendly policy was to ensure that the youths develop and utilize their potential in development of our nation. So as they come for healthcare services, we should also be able to link them with other sectors, employment, issues to do with mental health, if they have any issues with the psychological issues, social services. So this is why we should have counselors in the youth-friendly services, where all these informations, we can get the information and we can help these youths and help them acquire, maybe get networks, and these networks will help them to achieve their potential and develop our nation. What are the challenges of youth-friendly services? One, structural barriers. Some of them are roles and policies requiring parental or partner consent. In Kenya, adolescent is defined as any child between 30, up to 13 years or up to 18 years in Kenya, but WHO is up to 13 years. And the rules are very certain that anybody who is under 18 cannot give a consent. So such laws are some of them that are barriers to health, to reproductive health services. But remember, any client who comes to you for either any reproductive health service, you have to offer, as long as that person is sexually active. Distance from facilities, cost of services, and/or transportation. Of course, cost is a hindrance, and remember that most of them really don't have money. They don't have source of income, so these are one of the distance, and all accessibility to the facility is one of the hindrance. The other one is long wait times for services, and this is what we are telling the healthcare providers. We should try as much as possible to handle these clients as quickly as possible as they enter into our facility. And this one will make them feel happy, and they will also feel comfortable, and it will reduce stigma because they don't want to stay there for long. So if a young person comes to your facility, attend him or her, and then as quick as possible, and then let him or her go. Inconvenient hours of service delivery. Remember, our service delivery in health facility, most outpatient facilities, 8 to 5. And these 8 to 5, these young people are either in school or either in colleges, or either in a working place. So it is very, very important, if you are able, as healthcare providers, to extend these hours, at least to be able to get this very important population of our community. The other one is lack of necessary commodities at health facilities. Sometimes facilities will go out of stock out. Sometimes some of the services we offer, some of the services they want are not offered in our facility. These are hindrance by itself. Lack of privacy and confidentiality. It is a rule that all the healthcare workers, including casuals, to understand that ethics is very important, and one of it is privacy and confidentiality. We are not supposed to give out information of any client to an outsider. We are not supposed to share. And then the privacy, where we see our patients, it should not be an open place, should be a private room where we can discuss the issues of reproductive health. Socio-cultural barriers, such as restrictive norms and stigma about adolescent and youth sexuality. Remember, it's a culture where we say that young people are not supposed to be sexually active until marriage. And that norm, social norm, is one of the problems that these patients or these clients may hinder them to come to seek health care, because they don't want to be seen by even a relative or even a neighbor, because they think this neighbor will go and inform their parents. So, or even how do these people will see us if we are coming to a health facility. So, social norms. The other one is inadequate or harmful gender norms, like FGM, female genital mutilation. All this also affects the reproductive health, how these people will seek for reproductive health services. So we should understand, we as healthcare workers should understand the socio-cultural issues of a certain community. And this is where, when you are posted in a facility or in the facility, it's good for you to go and understand, try to understand the cultural issues, the social issues, and the norms of that community before you start to offer services, so that you can understand them. Discrimination and judgment by communities, families, partners, and providers. Remember, these people are young, and then you find that the community is saying, no, so-and-so is misbehaving. So these are very important things that we should understand. But remember, the policy, the youth reproductive health policy of Kenya says that even the youths have a right to reproductive health issues. So remember, it's their right, even if you are judging them. So us as healthcare providers, we should not judge them, but we should help them achieve what they have come to get. The other one is individual barriers. This is incomplete or incorrect knowledge of sexual reproductive health, including myths and misconceptions around the contraception. Some, they don't know how the family planning works. They don't know when they have STI, where they should go. Some myths of treatments that are very misleading. The other one is limited self-efficacy and individual agency, that is constrained ability to navigate internalized social and gender norms. This usually is the issue with the program and even the staff who are offering the services. And the other one is lack of access to information about what sexual and reproductive health services, where available, and where to seek the services. So some of them don't know that there are health facilities where they can go and get the services. So some of them, so they just stay home with their problems. They don't know where they can access the services. That's the reference. So it's good for you to go and get more information from these references. And therefore, what I can say is today we summarized, we are looking at, just a summary, we are looking at the youth-friendly services. We have defined what are youth-friendly services. Then you have said what are the characteristics of the healthcare provider, the characteristic of the environment, the characteristics of the program. We have still went ahead and looked at what are the barriers of reproductive health services for the youths. And eventually, we have seen how we can prevent, or how we can prevent these barriers so that we are able to give this important population the information they want regarding reproductive health. And with that, that's the end of our lesson today. If you have any question, we have the online platform. We can set the question or queries, and I hope you are going to interact with that. Thank you for listening.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.